Assalamu alaikum. My name is Naseem Rafiq and welcome to my channel, The Gold Principle. Please like my channel, subscribe my channel and be with me for upcoming new videos. So today we are going to learn how to remove vaginal packing. The aim to remove vaginal pack is definitely to remove the vaginal pack without giving any kind of discomfort to the client. So let's look at the. We need 9% saline, 10 cc syringe, sponge holder, kidney tray, Macintosh or plastic shield, and disposable gloves. Let's start the procedure by greeting the clients. Assalamu alaikum. How are you, Miss Shazia? My name is Naseem Rafiq and I'm your nurse today. And I'm going to remove the vaginal pack as by doctor advised by the doctor. So, do you allow me? Thank you very much, Miss Shazia. So, ensure that you are at the side of the right client. Check the order carefully that you are going to remove the vaginal pack of Miss Shazia or someone else. Just check one more time and confirm with the patient MR number, with the patient name, okay, and check the wrist, okay. Alright, okay, this is Miss Shazia, okay. So now I have confirmed that I am at the side of the right client. So now we have checked our client, we have provided the privacy, we have seek the permission. Now I will make the position and I want the height according to my level to make it easy and comfortable for the client and for me to remove the vaginal pack. So I will up the that side. Okay. So now I will make the position. Patient position must be like this with the dorsal position, and then we will bring the client a little bit down and then we will make the next step. So now I have made the position, I brought the patient down. The first of all, I am going to place the sheet, the Macintosh, the plastic sheet under the patient buttocks. Here you can tell your patient to cooperate with you. Okay. So now our sheet is ready. Now I will expose the patient. So I have removed the patient trousers and now the patient is ready to remove the pad. So I remove the pad. I will check if there is any blood. I will assess the blood, that how many ml the blood is there, and later I am going to document it. So now I have checked, I have going to discard it, and now at this point you are going to do the vulva swabbing. For vulva swabbing, you can watch my previous video that how to do the vulva swabbing. So now I have cleaned the area, I have done the vulva swabbing. Now I am going straight to my procedure. So before removing the vaginal pad, I have filled my syringe. I filled my syringe with the normal saline 10 ml. I am going to remove the cap and I am going to take this syringe and I am going to take the receiver down. So with your thumb and the finger, you are going to open the labia majora and minora and you will add the water. Why we are adding the normal saline here, I am using the water name for the normal saline actually. So why we are adding the normal saline here? Because we want to soften our vaginal pack. So now I have softened our vaginal pack. Keep the syringe in your left hand. Now take the vaginal pack slowly. Don't be too hard. Okay, and with the circle motion, slowly you can take your vaginal pack out. Okay, Okay, if you will see any note or anything here, note might be painful for the patient, then you have to go slowly. And after taking a little bit, then you have to add again, drop the normal saline, okay, and then take the vaginal pack out, okay, then add a normal saline, flush it, and then take the vaginal pack out slowly and gently. And when you are doing this procedure, tell your patient to breathe out so the patient will not feel pain. Okay, please Miss Shazia, breathe out. Okay, here again we will add some more normal saline and we will take it out. Okay, then at the end again we will add the normal saline and we will take our vaginal pack out slowly and gently. So we will check the color and the amount and we'll check the whole pack is with us. So okay, so at this point you check if there is still the vulva is not clean, then you can use swab and clean it. Okay, now our vulva is already clean, so I am going to put a new pad for the patient. So this is the new pad. So I'm going to cover it and then I'm going to give the clothes to the patient, the trouser. Okay, now we have placed our pad. Now I'm going to remove our sheet. Okay, remove and discard it. Check your equipments. Okay, and then give the dress to the patient, the trouser, and make the patient clean and comfortable. Thank you very much, Ms. Shazia. Document the whole procedure. Write down the amount of blood you have checked on the pad, and then write down the color and write down the whole procedure you have done, the vaginal pad you have removed, at what time, at what date, and the color and everything. Okay, if anything and if you will observe any other kind of thing, please document it. Thank you.